Hope you're well stretched out and all good. The post-lunch blues aren't going to be hitting you, and you're all good for the afternoon session. I do want to remind you that if you have a reason to be venturing into the exhibition hall, we do mindful that the noise from the hall comes in, so we do ask you to enter and exit as quickly as possible and not to be lingering by the doorway. I'd like to also thank some of our sponsors at this point in time: Aetna, Infinite Mindcare, Baptist Health Miami Cancer Institute, the HSA Public Health Department, KPMG, Cineco, Healthy Futures Limited, the Wellness Center, and Dana-Farber Cancer Institute. Our next speakers will be presenting on the topic of mental health in the workplace, evidence-based practices inside and outside of the workplace, challenges and opportunities globally and in Cayman. Sutton Burke is the owner and clinical director at Infinite Mindcare, and Fiona McDougall is the owner of Healthy Futures Limited. Ladies, the floor is yours.
Thank you, and good afternoon. So I hope everyone really enjoyed that yoga. That was a fantastic start and a perfect lead-in to thinking about mental health as we're all coming together for this event. So my name's Fiona McDougall, and I'm the founder and co-owner of Healthy Futures Limited. We are a business consulting practice and based here on the Cayman Islands. Our focus is on strategy, operations, and team synergy, corporate synergy. We do a lot of work with healthcare organizations, pharmaceutical, public sector, and then that's my day job. And then on the side, I'm also a volunteer. I'm the chair of the Mental Health Commission. And today, I have the pleasure of co-presenting with my colleague from the Mental Health Commission, Ms. Sutton Burke. Sutton, I will allow you to go ahead and introduce yourself.
Good afternoon. I am the owner and clinical director of Infinite Mindcare, which is a counseling organization on island that services older teens, adults, couples. We specialize in working with first responders along with drug and alcohol. So thank you so much for having us today.
Okay. So today we're going to be speaking about bridging the gap, right? So we want to bridge the gap between the corporate world, the workplace, and the clinical world when we think about our community mental health care services. And the goal being optimal mental wellness. So when we think about mental health, it's helpful to all align on the definition. So let me present to you the definition from the World Health Organization, where we define mental health as the state of well-being in which the individual realizes his or her own abilities and can cope with normal stresses, and that's a key word there, normal stresses. Normal stresses are not war. Normal stresses are not a pandemic. Normal stresses in life, and can be productive, can work productively and contribute to his or her community, right? So that is the definition of mental health. So why is this important in the workplace? Let's do the math, right? How much time do you think we spend in the workplace? Your average worker, right, is working 8 hours a day, probably getting 3 weeks vacation, 10 sick days, 10 stat days. Sleeping, if we think about waking hours, sleeping hopefully 8 hours a night. Put it all together, you're spending about an average adult, full-time work, 35% of your time is spent in the workplace. So that environment is critical to your mental well-being, right? And so there are positive attributes to being at work, right? We want to be able to function really well at work. There can also be negative aspects. It all depends on the corporate culture. It depends on whether there are supports in place. But here's the key message for employers, right? So coming from the corporate side, and then we'll bridge to the clinical side. From the corporate side, mental well-being is good for business, right? So employees who are well mentally have better engagement in the workplace. They've reduced absenteeism, and you've got higher productivity. So this is the investment that employers do want to make, right? When we think about what those essentials are, that's this graph here that shows you, first and foremost, do no harm, Employers should be doing no harm. We're there together to work with our employees to advance our cause, our vision, our mission, right? Our employment, an area of employment provides us with connection and community. We want to achieve the right work-life balance, recognize we're human beings with families and other obligations, right? We want opportunities for growth, career growth, and mattering at work, caring about that mission that we're showing up to the workplace for collectively. When we think about mental health in the workplace, there are some key statistics that kind of drive home some really scary, actually, messages in terms of some of the results of research that we've looked at post-pandemic. So in particular, when we looked at research from 2022, we see that nearly half of all employees are indicating that their mental well-being has declined, right? 28% of people are miserable in the workplace. Like, that's awful. This is 35% of your time that you're spending there, right? And from a clinical perspective, 1 in 6 people are actually experiencing a diagnosable mental health issue in the workplace, right? In general, 60% of employees are feeling emotionally detached. Where's that connection? Where's that community? Where's that tie to the mission, right? And this is a huge cost for employers. Again, mental well-being is good for business, right? 12 billion working days are lost every year. This is just due to depression and anxiety, just 2 conditions. That translates into $1 trillion worldwide. There's a lot of money that's left on the table that employers should care about. So these 2 things are not contradictory. These are working together. There's another side to it as well. And over time, our jurisdictions across the world have started to really pay attention to the benefits of having workplace wellness, but also the costs and risks if employers don't provide safe, healthy working environments. So I'm sharing here 2 cases with you, one from the UK, which I believe was from 2008. And so this employee, Miss Dickens, that's her real name, she worked at O2. In this first instance, it was actually the workplace environment that caused her mental health issues. That environment was so stressful, and she had multiple times said to her employer, "I am at my tethered end." She had communicated. She had let them know where she was at. They provided EAP services. So it sounds like that should have been okay, but it wasn't, because the workplace stressful environment continued to exacerbate these conditions, and she was getting psychologically damaged. And as a result, she ended up leaving, and they sued and were very successful because the courts determined that EAP, given the circumstances, given the stressful environment that she was working in, was insufficient. She had absolutely been able to prove that there were damages for psychiatric injury due to excess work-related stress. So that was awarded. Very recently, in 2022, we have a case in the US. So in this instance, the employee wasn't damaged by the work environment, but had experienced a severe episode of depression as a result of outside conditions, etc., and so took a leave, and the company provided the leave time. That employee got the treatment that they needed, managed to recover, got a letter of clearance from the physician, came back to the workplace. So all is sounding really good, until the employer said, "Well, we don't think we can trust you anymore because you went through this episode." Can you imagine? If you broke your foot, you went to the hospital, you got treated, you got a cast, you were recovered, you came back to work. "Sorry, I don't think I can trust you anymore. You might have some residual effects from that broken foot over the next few years. I can't employ you." So anyways, they terminated that employee, who subsequently and rightfully sued and was awarded $250,000 US. And the company was directed by the courts to put better policies in place, better training in place to adhere to legislation that does not discriminate against people for having a mental condition, and in particular, this case, who'd fully recovered and back in the workplace ready to work. So these are serious considerations, and these are not isolated events, right? When we look at the prevalence, like what is the likelihood that I'm an employer, I own a company, lots of you in this room are also employers or managers, the prevalence of anxiety and depression, just 2 conditions, in the workplace is very high, right? We're looking at, this survey looked at, out of the UK, looked at the prevalence of anxiety rates in the workplace. 60% of employees reported symptoms of anxiety. 56% of individuals reported symptoms of at least mild depression. And overall as a group, From a clinical assessment standpoint, a quarter of all of those who were surveyed met the criteria for a diagnosis. So not just mild, a quarter were diagnostically relevant. And the levels of stress that employees reported experiencing was 76%. So this is not isolated. The risk of those legal implications and all of the lost productivity is real world, right? This is not theoretical. So certain industries, however, have higher stress rates. So, going a little bit further, let me hand over to Sutton, who can speak to you a little bit more about specific industries that you will be very interested in.
Thanks, Fiona. So all of these people on the screen, or these industries on the screen, I consider first responders. And for me, that's one of my passions, is working with first responders, and certainly something we do at Infinite Mindcare. And there's a few different reasons why. One is because I have this just infinite gratitude for people who are keeping me safe and who are protecting us, and for people who I want to look to one day, God forbid myself or my family ever has the worst day of our lives and needs to call upon them. And selfishly, I want to know they're being taken care of. So when you look at the screen, I consider first responders 911, EMS, police, fire, also surgeons. People working in an emergency room are first responders, and certainly social workers. So there's a few interesting statistics I want to touch on, and one is that police and firefighters are more likely to die by suicide than in the line of duty. Certainly that's the case in Cayman. These are UK and American statistics, and thankfully our statistics are quite different in Cayman, but I just want you to sit with that. Surgeons have the highest rate of suicide amongst all physicians. All of us perceive stress differently. And I would imagine most of you say in the work that you do have a lot of stress. Your job has a lot of pressure. But we could all agree that objectively, first responders and the people on the screen, they objectively have very, very high stress jobs. Now, when we talk about stigma in the workplace, what's interesting is that 85% of first responders will get diagnosed with a mental health issue in their life, or have a mental health concern in their working years, but they don't share it that often. They're not likely to tell their employer, their colleague. They're not likely to tell a mental health clinician who's even coming into the workplace to speak to them. We learn about their mental health concerns usually after a crisis, usually after a critical incident, when it's the tipping point, and then they end up sharing with us. And that's unfortunate. And there's a lot of stigma of why. One of those reasons is because 40% fear being demoted or fired. And what's interesting is the fact that there is this high rate of mental health concerns amongst first responders, surgeons, and social workers, but yet they have this innate resiliency. And this really I want to talk about in regards to stigma, because we often think someone that's diagnosed with a mental health disorder, or that is experiencing a mental health concern, that they can't do their job. That's one of their fears of getting fired. Maybe someone's going to think they can't do their job. But the first responders that we've worked with are excellent at doing their job. And some of them have some severe mental health disorders or have experienced severe mental health concerns. And those are the ones I want answering my call. Those are the ones I want taking care of me because of how well that they are able to cope when they're on the job. And that's often forgotten. When we talk about stigma, there's a few things that run through our head that might be actual stigma that's happening in the workplace that's very real, or just our fear. So one, I said, the fear of being demoted. If someone knows that I'm experiencing a mental health problem, or I have a diagnosis, they're going to demote me. They're not going to give me a promotion when I'm up for promotion, or I'm going to get fired. Another one is just they're going to think I'm not good enough. I'm not able to cope with this. And that's maybe going to be, the whispers in the office. What if my boss thinks I'm making this up? And I have heard managers say this. I don't know if that's really true, if that's what's going on. Maybe they just want to stay home. So it is perceived, and it's also real. Certainly, when we work with first responders, and I've heard this from several industries in the healthcare world, is I chose this life. I chose this job, and I should be able to handle it. This is what, this is what having this job means, and I need to suck it up. And if I show that I'm experiencing anything other than that, and I'm not able to handle it, or I'm experiencing some kind of emotional concern, I'm going to be looked at and told that I shouldn't have this job. And I think that's evolving. Certainly, that is a very real old school mentality and thought. I have been with fellow mental health commission people around different industries or agencies on the island where I have been told, well, this is the job you chose. And this is from directors. This is from training managers. And thankfully, a lot of them are retired or retiring. And we want to train them, and we want to help change that and really break the stigma and bring awareness. But sometimes that's ingrained in someone's psyche, and it trickles down to other employees. So I want to pass it on to Fiona now to talk about some risk and safety factors in the workplace that really perpetuate the stigma.
So we've talked about the prevalence. We've talked about some of the concerns folks have, the employee side of things. But let's talk a little bit about the hazards, right? So what are some of the occupational, psychological, and physical safety factors that employers should be considering? So for me, when I look at this graph that I put together, there's 3 different colors for a reason. So the top layer there are when I think about psychosocial risks, because there's so many, let's categorize them. The first layer is sort of those, what I call ways of working, the wow. And maybe it's like, wow, where you work is amazing. Or maybe it's like, wow, what a horrible environment. How do you wake up and go there every day, right? So what are the ways of working? We're talking about culture. We're talking about the leadership and the management style, how people engage with each other, how you talk to each other, what the behavior norms. So those are the ways of working. That's the wow factor. And then in the middle, you've got the work expectations, right? So work expectations are often found in your job description. They're found in the hours that you're expected to work. One of the earlier discussions was talking about, shift work, and is it reasonable to do, daytime shifts, 2 days off, nighttime shifts, 2 days off? I mean, that's constant jet lag, right? So work design, performance plan, working hours, these are all contributing factors that could, enhance or decrease your safety factors in the workplace. Then you have your policies and your benefits, right? So do you have policies in place that enable folks to speak up about concerns for their mental health, for their physical health? Do they have access to psychological support through their benefits system? Is their health insurance covering that? So we look at not just physical safety, but mental health safety, EAP programs, and training. Is there training in the workplace to make sure that our managers and our leadership understand how to manage risks? So that's kind of an overall framework, but the reality is that even if you, as a manager and as a business owner, think about all of these conditions, it doesn't prevent every situation, right? The reality is we are all human beings, and every organization changes frequently, right? People come and go, new jobs, new roles, the environment in which we operate changes. So psychological risks and hazards are going to present. 2 of the ones that you should really recognize as red flags come in the form of risks that result from discrimination and harassment in the workplace. So right now, the Cayman Islands has out for consultations the sexual harassment legislation, so that's helpful. We know that the labor law also includes components that are to prevent discrimination, including against mental disability in the workplace. But it doesn't mean that these risks won't emerge in the workplace. So the key thing is when we think about, as those risks emerge, that they're not just one big category of discrimination and harassment. Harassment, as an example, comes in many different forms. You've got power differential, you've got gender harassment, you've got race and ethnicity. You've even here in the Cayman Islands got immigration status considerations, right? Are you on a work permit? Are you Caymanian? These are all considerations that can contribute to harassment in the workplace and discrimination. One of the most prevalent, as you see from the numbers there, is actually workplace bullying, right? And what's interesting, if we think about, the last few years with the pandemic, is that cyberbullying has actually grown tremendously. And in fact, it's younger workers, so those between sort of the ages of 20 and 44, who actually report the highest level of cyberbullying. So, when we think about our environment, where we've come from, and the considerations post-COVID, there are a lot of negative considerations. There's also some positive things, like remote work and being able to work remote. Lots of good things there as well. But let me hand over to Sutton, who can talk to you a little bit more about those workplace environments post-COVID.
So we can't talk about mental health in the workplace in 2023 without talking about the impact that COVID-19 had on all of us. And we'll start by focusing on just a few positives. One is that remote working and flexibility. Before this, maybe only some of us heard of a 4-day work week or of flexible working times. A lot of people were just 9 to 5, 8:30 to 5, right? And COVID-19 allowed for a lot of flexibility, and a lot of companies moved to having that flexible schedule so that someone could wake up, be with their kids, start a little later, right? Take a longer lunch, maybe work in the evening because that was better for those people. And that's continued. And so many people still talk about the importance of having that flexibility and why they may love the job that they're in because they have flexibility of time. So people can now hang out with their kids longer, go to after-school activities, travel. You can live around the world working for some companies and, maybe be in a lot of different remote areas. This is great. This leads to a really good work-life balance that you get to be home, and then if you're a parent, you can be with your family and, still manage your career. Also, reduce commute stress. So for those companies who kept having that flexible schedule, this really allowed those people in East End to Savannah to, leave after traffic. So you could maybe be working from home or ask if you can just work a little bit later. And now, you leave your house at 9 o'clock instead of 7 in the morning or 6:30, right? And then one that I quite haven't gotten a hang of yet is that tech and collaboration has really been enhanced, and really understanding all the different technologies that allow people to collaborate and to be online. It really just creates a lot more efficiencies. I'm still working on that myself. Certainly, there has been a negative impact on mental health in the workplace. And before this talk, I was speaking to someone in the ministry about how when COVID came, the focus became on the initiatives for COVID. And maybe some of those new initiatives and those new advances for the business, for the department, that everybody was really excited to do, they're put on the back burner. So now we're scrambling to catch up, and we're behind on those things that really are some of those huge goals that people were looking forward to, or just the advancements that people really needed. So there's an increased stress with that, and with increased stress, the increased burnout. Lots of last minute changes, lots of new structure that's, maybe not clear for people. During COVID, we didn't know what to do. So we were making it up as we go. And what we do know is not having clarity on what someone's supposed to do in their job does impact people's mental health. So right now, we're slowly coming out of it, and what we're hearing more and more is burnout. And how we're gonna cope with burnout and what we can do for burnout. But more absenteeism, more sick days, and people actually expressing themselves as someone who is burnt out. The next is job loss and economic uncertainty. So something that I would say is added stress and added to the burnout is job redundancy. During COVID, people lost their jobs, but a lot of jobs became redundant, and then that was added on the current employees that were left there. Lots of stress with that. Lots of, unclear uncertainty on if they were going to have the money to pay their bills. I know that as a business owner in the healthcare industry, that first couple weeks when we were locked down, we were experiencing so many cancellations because people felt that they didn't know if they're going to be able to pay for their mental health appointment. That also speaks to stigma on mental health, that people who have a diagnosis, who really need the support, feel like that would be one of the things that they could put to the side, which we won't do with a lot of other physical ailments, right? If you have diabetes, you're going to show up to your diabetes appointment to take care of yourself. But this self-perpetuated stigma and really stigma in society really pushes that on us. So the one that I see a lot is the impact on isolation and loneliness. So when we have people in society, even before COVID, who are just very socially anxious, anxiety in general, people who have a diagnosis of depression or more prone to depression, the natural instinct is to stay home, is to not engage, right? Is to hide. My new favorite Gen Z term, bed rot. So, you know, I'm going to go to work, I'm going to go to school, and I'm going to come home and lay in bed and do everything from bed and do nothing. And when you have COVID-19 and people who are already in that state of mind, then, you know, we're perpetuating that and making it so much worse. So then people were so disconnected. We need people. We know all the statistics that being connected with people socially has you live longer, right? We need to engage with others. And that had a really big impact of just being home, being lonely, not being connected to people. And certainly, we know one industry that did not suffer during the pandemic, the liquor industry, right? And so one impact that we see in the workplace now, in an impact on people's mental health, is an increase in alcohol and drug misuse. And what does that do to your employees? You know, you might not be able to pick it up, right? If you're not a professional working in drug and alcohol rehab, but there's something going on, maybe difficulty with sleeping. Because a lot of people who drink and use, they might think that that's helping their sleep, when in fact, they're not getting that good sleep that they need. So that had a huge, huge impact on us. And then, of course, the challenges for parents. And we know the challenges of teaching your kids and being that teacher during the pandemic. But what's happened now is some of those kids got behind because they weren't able to do online school, or it was not effective for them. And those parents now are back in the office, but they're having to deal with the struggles of their children who maybe got ill during the pandemic or had some, you know, educational concerns. So I'm now going to transition over to Fiona and get back to how employees can recognize mental health in the workplace.
All right, so we talked a lot about, you know, the prevalence and the fact that it's increasing, and then the work environment, which has changed because of the pandemic. And so, you know, the first thing I want to say from a corporate standpoint, as a business owner, is number one, is that it's only mental health professionals like Sutton, or many of you in the room who I see here today, who can actually diagnose a mental condition. Having said that, employers who notice signs and symptoms of change in their employees in a negative way can think about, what does this mean? Should we or should we not have a conversation? Do I have enough resources in place? So when we think about recognizing mental health issues in the workplace, there are behaviors and signs that employers and colleagues may want to watch out for, right? That may indicate somebody is struggling with their mental health. So I've put a dozen here, so that's a lot, right? And some of them are more obvious than others, right? So, you know, changes from normal behavior. If it's somebody who you've worked with for many years, for a long time, and all of a sudden things have really shifted, that's probably a flag, right? Less engaged than usual. Perhaps there's a significant decrease in productivity, right? So in a mature organization that's managing workloads appropriately and tracking outputs and deliverables and you know, work hours and all that, you can start to see, is there a real change here in productivity? And that might be something to investigate, right? The employee's socially withdrawn. If you've got social events and all of a sudden they no longer come, or they're no longer around the water cooler or joining folks for lunch, that may be a sign. Some of the more difficult ones might be, you know, addictive behaviors that Sutton just touched on. You know, fatigue, sleep issues, maybe not as clear, but if they're looking very tired every day or head down on the desk. I don't know if any of you have had those days. I've literally put the head down, had a little nap. Happens, right? Appearing sad or depressed, right? So there are signs and symptoms. And the key thing from an employer perspective is always number one. As I said, first of all, we're, employers. I'm not a mental health professional. I am the layperson, or one of the lay people on the Mental Health Commission. I've happened to work with many mental health organizations, governments, healthcare providers for the last 20 years. So the operations, strategy, clinical planning side, but I'm not an actual mental health professional who's a counselor. But what I can do for my employees and for my client staff is make sure that the right supports are in place. Make sure we know who in the community we can refer to, right? And recognize the signs and symptoms, right? Increased absenteeism, different work patterns. So that's one thing as an employer you can do, is be alert, be aware, are any of these flags being raised, right? In addition, there's a lot of structural things that employers should be putting into place to manage the psychosocial hazards, the ones that I listed earlier, at work, right? And it's really sort of 4 broad categories if you think about it in terms of steps. So first is to identify, right? Identify, are there psychosocial hazards and risks in our workplace, right? So in the workplaces, in the industries that Sutton was touching on, with social work, with first responders, lots of psychosocial hazards. So let's identify what they are. Let's talk to our employees. Let's survey them. Let's observe. Let's get the reports. Let's see how often incidents are happening. How are they managed? So first is identify it. Second is assess, right? And when we think about assessing, we assess for the purpose of prioritization. So that means first we think about, okay, what is the magnitude of the impact of a given psychosocial risk? And second, what is the probability that is going to occur? And then it's math, again. So that helps me prioritize, right? Something that's happening frequently that has a big impact, probably something we absolutely need to be on top of. That's my assessment. Once I've assessed, I move into control mode. What can I do, ideally to eliminate the psychosocial hazard or minimize the likelihood of it occurring or the likelihood of the impact being large? So then I try to develop plans, put policies in place. We do education and training, containment, and expedited planning. So we know that something is going to likely to be occurring on a regular basis because that's the industry we're in. And so what's our plan to address it, right? How can we control it? Because we know it will happen. We can't simply prevent it. And then step 4 is coming in and reviewing and evaluating. How is this working? Let's regularly review. Are there new hazards and risks that we need to consider, right? How effective are our responses? And do we need to update our policies and our procedures? So all the planning in the world doesn't mean that we can prevent things from happening. So we're human beings, as I said. We don't hire robots. I feel like I say that a lot. And I have said it a lot over the years because as humans, we come to work with our entire lives. We come with our baggage. And so that means that we also come with different emotional states on different days, things that are happening at home, right? We're not just AI tools there to plug data. So we really need to anticipate and expect that things are going to happen in the workplaces. Workplaces are stressful environments. There are moments that are more stressful than others. However, how we respond to those stresses as managers and as business owners is critically important, right? As you can see from some of the stats here, so this survey looked at employees and asking them how confident they feel their place of employment is able to respond to issues of harassment, and the numbers are horrific, right? 40% lack confidence in the organization's ability to address harassment. They don't get communicated, they don't know what the plan is. We actually see resolutions from investigations being less effective, and a third of employees basically say, we don't even know what the investigation results were. I have no idea what the outcome was of something they experienced. And importantly, they're not even monitored. 73% of employees who experience issues in the workplace reported them, had them investigated, some form of resolution was determined, but then they weren't monitored for signs of retaliation after the fact for, a significant incident that happened in the workplace. Retaliation is something that people fear significantly. So, the message for leaders and managers is, number one, just like in the healthcare industry, do no harm, right? Monitor for harmful behaviors and lead by example, right? Reinforce those healthy workplaces, work-life balance, making sure that folks are, getting up out of their chairs, they're not sitting there for hours, that they're not isolating themselves. If they're working from home, if they're working remotely, making sure that they stay engaged, right? And then when the issues arise, we recognize and we respond appropriately. So that's critical. I have a question for all of you in the room. Who remembers something called a BlackBerry? Anyone? Do, okay. So I'm Canadian. So for me, it was the BlackBerry story was very, very close to home. I had a Blueberry, I had a BlackBerry, I had a Torch, I had all the versions, right? Because I think I got my first Blueberry, as we called them, because it was the blue one with the gray keyboard. Do you guys remember that? That was back in 1998, 99. I'm aging myself now, I recognize that. But let me play a little video for you, just to shed a little light and give an example of, an emotional reaction, a human emotional reaction at work under a state of stress and duress.
55, we're back with Fox 5 Consumer News. A global BlackBerry crisis this morning. The company says it's experiencing massive service interruptions. The company's helpline says that users can expect delays in sending and receiving messages.
Yes, we are aware of the problem, and we are sorting it out right now.
It's down over there, doggy.
We've been down for this long.
All that is down there.
Are we totally?
Hey! Quiet!
Let's just keep it down out here, guys, for a second.
How many are down? Maybe 10,000? Oh, Jesus. Okay. Hello?
You have a collect call from.
What the is happening?
Will you accept the charges? Are you still there?
Yes, I accept.
Thank you.
Mike,
Hi.
there are 3 reasons why people buy our phones. Do you know what they are?
Well, email?
They work.
Yeah, okay. It's not us, Jim. It's the carrier. Verizon is doing something weird.
Okay, well, I'm about to do something weird if you don't fix this. Now! The deal was, I get the engineers, you shrink the data!
Are you selling more phones?
What the hell do you think I've been doing over here, Mike? We're in the middle of a hostile takeover! Do I need to have somebody babysit you, dork?
Okay. So that's... Okay. Yeah, the entire system is crashing. He's selling more phones.
God damn it!
Yeah, so... Okay,
Maybe just hold off selling more phones.
I'm not
Did you hear that drum beat in the background of that clip? I could feel it underneath here. That was like a heart beating. The level of stress being on the receiving end of that poor phone. Do you guys remember payphones? So I don't know if anyone's ever experienced or seen any reactions, emotions like that in the workplace. I have. I know many of my clients, even in former workplaces they've worked, have. Jim Balsillie, that's a real story, that's a real character, that's not made up, it's not fiction. So, the managing emotions in the workplace is a huge topic, one that doesn't get enough attention and enough support. So let me hand it over to Sutton, who can talk a little bit about how we regulate emotions in the workplace.
So, in extremely toxic work environments, like we just saw, because if you didn't see that movie, it went on. It was the entire time, not just in that situation. But in extremely toxic work environments, discrimination, harassment, this all has a major impact on employees' mental health. And while it won't be every employee who would have come in contact with someone like that, but for some, it's going to be a significant causation factor for PTSD, for depression, for anxiety, which is huge. So training leaders how to regulate their emotions, how to manage their emotions appropriately is going to be super effective in helping with this stuff. So what are you looking at in this particular picture? You're seeing a boss yell at someone. maybe point his finger at someone. And that seems like the obvious person who would need some training on how to manage their emotions. Now, the reality is we hear this all the time. In Infinite Mindcare, we lead a ton of corporate trainings. And it's interesting because a lot of times the managers are not present. Some organizations that we work with, we do trainings just for managers, which is fantastic. Stress management for the management team, which allows them a little more privacy and confidentiality, right? But so many organizations utilize our services and they don't include the people who really need it, which is unfortunate. And when we think about just our own mental health, if the environment doesn't change, like Fiona was talking about earlier, then that person is not going to be able to be as effective in their own counseling sessions. If they have to keep going to that same work environment, and as Fiona also mentioned, then lawsuits can happen, right? Because it takes two. So in this picture, we see someone yelling, obviously needs some mental health stress management training, some emotional regulation training. However, what we often don't think about is someone who reacts the opposite. So someone who is a manager or in a supervisor position, and they actually shut down during difficult conversations or the thought of difficult conversations. They get anxiety to have to give someone feedback. Maybe, anything that's perceived as negative. Maybe they get anxiety even with training or having to teach someone new policies and procedures. And so what often happens with that kind of manager or supervisor is then they're going to say nothing and they're going to do nothing. And you can imagine how that leaves an employee feeling very disempowered, not clear on how they can do their job, what they can do in their job. And then, as I said earlier, that leads to some mental health concerns and mental illness as well. So we want to make sure that we're capturing everyone in these meetings and we're really seeing the value of emotional regulation and emotional management. EQ would be the term, right? It's critical for managers. It's going to help managers and employees be able to manage their stress when they're in a crisis situation or when they're having to deal with employees that are maybe having an interpersonal conflict, or when there's a lot of pressure on something that's coming up, there's a deadline and everyone's feeling a certain way. That manager can be a source of calm. And the idea is that that manager can regulate their own stuff so that then they can focus on everyone around them, right? Okay, so how to assess a situation and regulate your emotions at work. We do a lot of training on EQ, and a lot of times people want 45 minutes for us to do it. A presentation on EQ in 45 minutes. That's just a little taste. We recommend doing at least a two-part series, 2 90-minute sessions to talk to your employees about emotional regulation, emotional intelligence, and really, I could offer you a 10-topic series, right? This is something that's an ongoing learning process, but we're going to go through 5 that maybe you can walk away with today on how to be a little bit better. So 1 is becoming self-aware of your emotions and your triggers. And then 2, accepting your shortcomings, right, and working on them. You can imagine these are the hardest 2 of the entire process. People get stuck on these first 2. So many people lack insight into their triggers. They lack insight into their behaviors. I don't know if that manager that we saw in BlackBerry is really assessing how his behavior impacts other people, right? That's just the norm. He thinks that maybe that's the reaction the situation merits and that's okay. So this is huge. One way to get a little more insight and have a better understanding of your triggers is to think about if you're coachable. Are you someone that can take feedback from others? Think of examples that, have happened over your career when someone was giving you feedback. Do you immediately jump into defense? Do you take responsibility at all, ever? Right? Now, with, a video that we're going to see in a little while, and thinking about what we just saw, it's like, okay, sometimes we do have to forgive. Some behaviors are completely unacceptable, and unfortunately, I hear about those kind of reactions that we saw on the screen too many times. And the thing is though, some people do react, and what do they do after? How do they clean up the mess? Do they immediately the next day go and say, oh my gosh, I can't believe I did that, and acknowledge their behavior to others? Some managers do, right? I don't know, does anybody have a manager that acknowledges when they misbehave? You know, we do all have our shortcomings. I love to see my staff raise their hand. We do all have our shortcomings, right? One thing, and I'll give you an example. Yesterday, we're getting ready for the healthcare conference, packing up our stuff. We have a lot of extra things we wanted to bring. And so when I called the office, one of my admins said, the other admin's out buying a suitcase to put everything in. And I'm like, no, like, I don't want to spend any more money on just extra stuff. And I instead of saying goodbye, I'll call you back, I was like, ugh, and hung up and immediately called the admin, right? And then 5 minutes later, I called back and said, oh my goodness, I'm so sorry for hanging up on you. You know, I blame my family that we're like, okay, love you, goodbye kind of people. But, you know, we immediately clean it up of like, oh, hey, that wasn't acceptable. I didn't want her to spend the money on the suitcase. So we take responsibility for the behavior. And, you know, part of being coachable and gaining insight into yourself is just seeing like, okay, what are those behaviors I need to work on and how do I clean those up on a regular basis and try to make better? So the next one is making sure that you take care of your physical and mental health. This one I feel like seems obvious, but the reality is if you're not taking care of your physical and your mental health, that's gonna cause more issues for you. It's gonna make managing stress and managing your staff so much more difficult, because if you're not managing your physical health, maybe you're not sleeping very well. And if you're not sleeping very well, maybe you're gonna be more reactive. Maybe your mood is not gonna be as good as it could be as if you were getting good and better sleep. Same thing with mental health. We got to walk the walk and do the things that we say we're going to do and have integrity. So when we're working with our staff on stress management and wellness and well-being and taking care of our mental health, it's like, well, are you someone who would also see a therapist? Sometimes I hear from people that are referring clients to us, they're like, no, I don't need that. You know, how do you look at it? How are you then recommending services and being someone that would recommend services to help someone if you don't believe it works yourself, or if you think that only people who are very sick go to a mental health counselor? So make sure you're taking care of your own physical and mental health. The next one is learn some relaxation techniques. So I could sit up here and teach you tons of breathing exercises. I think the young lady who did the 5-minute chair yoga, that was great, right? Because you could be at your desk, you can be super stressed, and you could be doing something to calm yourself down and get relaxed to get ready for that next big meeting or that really difficult phone call. Walking into the gym earlier this week, I was eavesdropping in a conversation that was happening in front of me, and the person was talking about a difficult meeting that they had and that they did not want to be interrupted 10 minutes before because they're going to be doing some meditation. And he talked a little bit about it, and I was like, wow, this is so good. He's setting a boundary, like, hey, my door is going to be shut because I really need to prepare myself. And it seemed like they both knew that the people in the meeting were maybe a little more challenging to deal with, and it was going to be a heightened pressure meeting, right? So, you know, take that time. It doesn't have to be 10 minutes. It could be 1 minute. You know, there's that great Calm app with the breathing circle. You can find that breathing circle on YouTube. I love that. You can do that for 30 seconds. Square breathing is a great technique. 30 seconds, 1 minute, just to relax yourself before you have to go into, you know, managing a stressful situation, dealing with your staff, doing something that, you know, might make you a little more heightened and emotional. So the next one is learning how to help manage the emotions and like the energy of your staff, right? If you come as a source of calm, then that's going to help maybe a crisis situation, or, you know, they're going to look to you to see how are you doing that? What are some of the tools and techniques that you use to help relax yourself? How do you deal with your own burnout? And this is just being transparent and being human. One of the things earlier was people don't share because they're maybe afraid of being demoted. They're afraid of not seeing like they're coping well or something. But it's important for managers, for directors, for HR people, for those supervising us to be human, right? Humanize yourself, and you experience the issues just like everyone else. And how do you do it? What are some healthy coping mechanisms? So we're going to watch 2 videos on a boss with 2 different employees and doing it well, being supportive and understanding in the work environment.
Hi, I'm so sorry. I saw your email at 11 p.m. I'm so sorry I didn't respond till the morning. Listen, if I ever email you after 5 p.m., feel free to ignore it until the next business day. I tend to respond to emails late at night, so feel free to ignore them outside of working hours. Oh, okay. Hi, how are you today? Are you sick? Oh yeah, but I feel fine. I took some medicine. No, you need to get some rest. Your health is the most important thing. After this call, I want you to shut your laptop, drink some water, and go to bed. I'll cover that meeting this afternoon. You just need to focus on getting better. Really? Huh.
So these two are great. In the first one, we saw the manager taking ownership of their own behavior, right? Sending emails after hours, at night and on the weekend, puts pressure on employees to respond. And there's, and again, perpetuating that stigma. If I don't respond, I'm not going to get that promotion. They're not going to think I'm reliable. Oh my gosh, huge deadline. I have to do this. This is your time to rest. This is your time to take care of yourself. However, as managers, supervisors, business owners, sometimes we work better at night and weekends. Things come to our mind, this is what makes us successful, and then we have to send it then. So the thing is when you send it, or when you do something that, might be perceived as a high pressure behavior, you acknowledge it. Hey, listen, you don't have to respond to my emails. I just did this a few weeks ago with my staff. When I send you emails in the middle of the night, please don't think you have to respond. And people said, thank you for giving me that permission, because that was a fear of theirs, which makes me sad. So it's just acknowledging that behavior. And there's so many behaviors that if we just acknowledge it, that puts people at ease. The second one is really good because it encourages wellness, right? How often do you just show up sick because you don't want to let people down? And I do think it's nice to have that, care and concern for your employer, for the business that you work at, and that you want to get things done. But if you're sick, and you need to take your day. And so it was really nice to see a manager saying, oh, wait, I see you. You're experiencing something. It's okay. Please take your day. Go home. Fiona's going to come up here now and talk about the legislation that supports that, because people are entitled to sick days, and we do need to be following the law when it comes to that and allowing them to have their days.
Yeah, so, it starts with legislation. Legislation provides a fantastic framework. It is foundational to, ultimately improving the environments in which people work. And there's different legislation across different jurisdictions. But, even in Cayman here, we have the labor law, we have our constitution, rights, freedoms, responsibilities. We've got privacy legislation. So, the basis is that it starts with legislation and law. But don't be mistaken, legislation does not equal protection. Unless you, as an employer, operationalize the legislation as part of the working environment, you're not going to be providing those rights to your employees. If they aren't aware of what their rights are, we can't expect employees to read the labor law, be prepared on their first day of work straight out of school. I know all of my rights and entitlements, right? That's our job, is as employers, as business owners, to operationalize that. And that means that you're taking what's in the legislation and you're putting it into workplace policies. And those policies then we've got to make sure are accessible, right, to the employee base. We've got an employee handbook, for example, or you've got, the policies online. You've got them written into your employment contracts. These are the examples as a starting point to make sure that legislation and regulation moves to the next level, which is policies. And then we make those policies accessible and we train on them. We train our managers, train our leaders, train your employees, and make sure that on a regular basis that folks are aware, because we've got people coming into the organization, out of the organization, changing roles, changing levels, and there may be different circumstances that apply to different parts of the organization. So that's step one, step two, step three, and then really you need to get that commitment and accountability, right? So sign off. I attended training. I may actually sign a harassment policy that I actually do have to sign on an annual basis, or a policy and procedure, standard operating procedure. So making those commitments and then ultimately building them into our performance plans, right? So in our organization, when we talk about setting people up for success, We're clarifying the expectations. And it's not just, performance management isn't just the expectations of how many widgets you produce and get out the door, right? It's expectations of behaviors in the organization. You know, we do an exercise of values cultivation where, you know, we help organizations identify the values that are most important to them and their customers and stakeholders. And then we talk about how to operationalize those values, right? How do we make sure that we have the right definitions of those values, that those definitions of the values translate into behaviors, that those behaviors are clearly understood. So those behaviors are defined. You know, what does integrity mean? It means, you know, choosing to do the right thing, which means that when I'm presented with XYZ, there's all sorts of definition, and then we put that into a performance plan, right? The values become the norms, become the culture, become part of the expectations for setting the organization and all its people up for success. So that's part of that commitment and accountability. And then we have to ensure compliance. Make sure that we're actually checking in. Are we walking the talk? Are we surveying our employee base on a regular basis? Are we making sure that managers are doing what they say they expect everyone to do, walking that talk? That's really important, and that's what operationalization is. So that's why I say legislation does not equal protection, right? It doesn't ensure that the rights of employees to take their 10 sick days, you know, or other rights that they have in the organization are adhered to. The Cayman Islands, as we touched on a little earlier, do have some unique considerations, right? So as I'd mentioned before, the labor law does include protection from discrimination, including for mental disability. However, the legislation does not specify particular policies that should be documented and available to employees. Other jurisdictions do have this, right? Like I came from Ontario, I ran a similar business in Ontario, and if you're an employer of greater than 10 employees, there are specific policies that you have to have in place, in writing, made accessible to employees, and trained on a regular basis. That's in the legislation, and it translates into a requirement from me as an employer to operationalize a policy. So some of those are gaps that we have here in Cayman in terms of the, you know, regulations that define policies to make sure we comply with the law, right? There's, you know, in the Cayman Islands, we don't have the same sort of established collective bargaining that we see certainly in Europe, a lot of collective bargaining there, trade unions, same in Canada and the US. So labor unions, if you recall, were brought about, you know, sort of back in the early 1900s, right? So as mechanization of the workforce came into play, and these were brought in to keep employees safe. We don't really have those here. In the Cayman Islands, we also have, as I mentioned earlier, that whole immigration status consideration, right? The work permits, right? This is a system that is tying an employee to their employer, which guarantees their residency, their pay. That's a great thing, but the challenge with that is it's also a bit of a handcuff that many employees fear raising issues or concerns from their employer about how they're being treated, because it could actually, you know, result in an issue with their residency, their children are in school. So the right to live in Cayman and also the right to actually have your health insurance, which is provided by your employer, could be jeopardized if you start to create a fuss about your rights, which leads us to health insurance. So employers are the ones who provide health insurance benefits. So health insurance benefits ideally include coverage for access to mental health care services, outpatient services in the community. If you're an employee who's on the SHIC plan, the Standard Health Insurance Contract, the limits of that plan are very narrow, right? So $400 for all your outpatient visits, including your pharmaceuticals, $200 total for wellness, and many of those SHIC plans don't cover mental health whatsoever in either of those two categories. So that's a huge challenge. So it starts there, and then if we think about that, what should that mean then for our employers in the Cayman Islands, recognizing the unique environment in which we're working, we can still make sure that we adopt some of the more important factors here, go above and beyond the legislation, above and beyond the limitations that we may have in the realities of our environment. So first is make sure that we've got those health and safety policies written, documented, accessible to everyone in the organization. Our performance side of things, what are the expectations all the way from our vision, mission, values to each employee's performance plan to make sure we're setting them up for success, getting those health insurance benefits in place and checking those plans. do they include coverage for mental health care in the community, that outpatient category, not just the inpatient category? Number 4, providing access to free confidential EAP services. There are many EAP services available on island. As employers, we should learn about those, avail ourselves to those. Number 5, we need to train our managers and leaders, as I mentioned earlier, to recognize, respond, and manage the issues that may arise, right? And if you need external support from the mental health providers in the community, reach out to get that training brought into your organization, right? And then lastly, recognize the fact that your employees and the employers were working together to, achieve a positive outcome for an organization. It's good business to have employees who are doing very well, who have good mental wellness. So from the clinical standpoint, what can we be doing? I'll pass back over to Sutton.
So the World Health Organization recommends that employers offer stress management workshops and counseling sessions to their employees. So like Fiona said, you just want to make sure that your health insurance plans that you offer do cover outpatient mental health. So that is the concern with the SHIC plan, that it only covers inpatient mental health, which most people will never need in their lifetime. And the ones that do need inpatient need a lot more than the $30,000 maximum that there is. So that's one way. We can also get an employee assistance program, which a lot of organizations on the island offer, where people can have access to mental health. And you can kind of do it almost like insurance, where maybe the company is paying for a portion or paying for half or paying for X amount of sessions per year. So this is recommended by the World Health Organization. Those stress management workshops, trainings are so imperative, and it's so important that employers put some funding to those areas to just help benefit the staff, which again, we've talked about, is going to increase productivity, is just better business for all employers and businesses. So the other one is psychotherapists in office hours. So something that we offer at Infinite Mindcare is called office hours, where we go into organizations, we sit for a few hours, 3 hours minimum, once a month or quarterly or a couple times a year. And anybody who wants to come talk to a therapist can come talk to a therapist. It's like your own personal psychiatrist, like on the show Billions, right? But for most companies, they can't afford to have someone so often. And it's a little unethical to have someone on staff that's there all the time, which we saw on the show Billions. But office hours allows for people to come talk to a therapist who may never ask for help. But if that person is there visiting for the day, they might just come in, start sharing, feel a connection, and have a better understanding of what counseling is, and then make an appointment to come to the office. So it's so helpful. Neurofeedback in the office. So something that's incredible, and if you haven't learned about it, I encourage you to go to our booth. We offer biofeedback, neurofeedback, QEEG, which is a brain map, part of the assessment, and it doesn't require much talk, but in my belief, it is a missing component in mental health. And being able to offer that at your company twice a week, or send them somewhere to get that. Neurofeedback's incredible for peak performance, for anxiety, for impulsivity, compulsivity. Incredible. First results you're going to see is the benefit to your sleep. So I know so many people, and I won't ask you to raise your hand if you have any sleep trouble, or the opposite, if you do sleep optimally 8 hours a night. I imagine it's not very high that people are getting that good sleep, and it's so important for our mental health. So highly recommend neuro. And then management and HR support. So often our managers, our HR managers, are looked at as counselors. They end up wearing so many hats. So want to invest in a little bit of money for their training on mental health and how to support their staff, and offer trainings for emotional regulation to their staff. There's so much support available on island, and if you look at this map, it's not all where all the companies listed on here, it's not the exact location. But there's so many great organizations on island that do offer EAP services, that offer counseling for employees that you can recommend, that most of them take insurance. You want to make sure then when you're recommending someone to go to therapy, or you're someone looking for therapy, you're going to someone who has a master's or doctoral degree, They are licensed, they are registered with CPAM, which is Cayman's registration licensing body. So you just want to make sure that you're sending them to someone who's master's, doctoral level, and there's so many choices that you can choose from, right? Very important for employers that if you're ever making a referral to a company like Infinite Mindcare or one on the screen, that you're not just sending us an email that says, oh, I want so-and-so to come in, right? Because when that person gets to our office, a lot of times they're like, I have no idea why I'm here. I'm fine. I have another therapist recently, has come up, and we've heard that a few times. We need feedback, and the employee needs feedback. And sometimes you might have given that employee feedback and they don't tell us, or it was one of those managers who I was talking about earlier who feels so uncomfortable to talk about that kind of stuff that they just said, you know what, just go talk to these people, and they send them to us. So you want to make sure that there was a conversation had. Fiona also mentioned getting things signed off. That something was signed, and maybe you can provide that to the counselor that you're referring so we have a little more background information. And if something has gone on in the workplace, like we saw with the manager yelling at their staff, that we would know about that incident, or maybe we can all talk about it together and see how we can work together to help learn what skills are needed, is the person coachable or not, and what we can do together. So I'm going to pass it back over to Fiona to really talk about how we're going to bridge the gap in the workplace and with wellness.
All right, so this is our sort of last slide of, bringing it all together. This is what we mean when we talk about bridging the gap between the workplace and wellness, right? So from my perspective, from the corporate perspective as a business consultant, I just want to reiterate that mental wellness is good for business, right? The clients that I work with who are most successful also have really happy, really engaged employees who have good work-life balance, who feel productive, and who really want to work towards the organization's mission, right? But, let's think about the steps that it starts with, looking at the far side of the chart there. First point of contact, managers and HR, getting those policies and procedures in place, first point of contact, and then aligning with our employees and our teams on those performance expectations, how we can set people up for success, and then, to Sutton's point earlier, having those difficult conversations. So whether we need to bring folks into the organization for training to help folks have those difficult conversations, or maybe send them out, but that's really the starting point, right? So that's the side of sort of corporate, moving towards wellness, and then reaching out into the community and partnering with those mental health providers in the community, like Sutton.
So important that you're recommending someplace that is confidential and giving really confidential treatment and support, and that, unless you're having to send a referral and you're getting that release of information, that you let those employees get the treatment that they need or that they're requesting, that you're creating an environment that allows an employee to come say, hey, I have a doctor's appointment once a week. I have to go to my counselor once a week. And then full stop. No, we don't have to ask about it unless the employee wants to share, right? Creating that environment. This is going to help create confidence and build resilience with your employees, and it's going to allow those trainings to be so much more effective. So you're really offering those stress management trainings that we talked about to support your staff, knowing that's just going to help your business and it's going to help everyone. So important to say that it's not just about the individual employee that needs to work on themselves. It's the organization as a whole, and we can do that together. Thank you so much for having us today. We have I don't know if we have any time for questions. I don't think so. But thank you so much, and I hope you enjoy the rest of the conference.
Thank you so very much to